All right, when you need help, you call 911. First responders are critical in any emergency, especially medical emergencies. But if there are not enough first responders to come help and the ones that are available are too far away.
Yeah, that's right. The problem is a reality for many in Pickens County. Grace Brister was there today to talk with county leaders about the crisis, and she joins us live in the studio with more. Grace.
Access to health care has been strained in Pickens County since its only hospital closed, and access to emergency health care is at a crisis point. There are simply not enough ambulances to cover the county or for the number of medical emergencies that take place. County commissioners, mayors, and a state representative met with me today to come up with a plan to tackle this issue. In Pickens County, staffing for emergency services is critically low.
After Friday, I will only have 5 employees.
Vicki McCrory is the manager for the Pickens County Ambulance Service, and she has seen firsthand people lose their lives because an ambulance was not available. In December, a West Alabama man was struggling to breathe and no one could get to him quickly enough.
It's terrible. It just shouldn't be an issue in this country, but it is all across rural America. Nobody should suffer for over an hour and not be able to breathe with no help. Unfortunately, he passed away in front of his 2 children.
For 3 years, the Pickens County Hospital has been closed, meaning the nearest hospital for residents is either Columbus or Tuscaloosa. Carrollton Mayor Mickey Walker says he has seen the fallout from this problem up close. Too close.
Had one die in front of City Hall. One of my employees had a wife pass away that if the hospital would have been open, she could have got there.
District 61 State Representative Ron Bolton says they are working to figure out how each town can share the cost for the ambulance service and how they can fully staff it.
We're trying to make sure that we can get people out to people that have medical needs to where they can then be transported, whether it be to Columbus or Tuscaloosa.
Bolton says depending on the level of service, the cost could range from $314,000 a year to $821,000 a year.
The towns have really going to stretch their budget to be able to afford to pay for the actual ambulance service, but we're going to come up with the money to do it. We've got to for the people.
Bolton says the goal is to reach a final decision by March or April on what level of service each town will receive and how much each government entity will be responsible for. Bolton says they would eventually like to see the hospital in Carrollton reopen.